Good afternoon and welcome to today's Downing Street press conference. I'm pleased to be joined by Professor Chris Whitty, Chief Medical Officer, and Sir Patrick Vallance, Chief Scientific Advisor. On Saturday, I spoke to the Prime Minister. I updated him on coronavirus, the progress we're making, and our plans for the next few weeks. The government is united in our focus, our determination, and our national mission to defeat the coronavirus, and defeat it we will. I want to join the PM in expressing our heartfelt thanks to the brilliant team at St Thomas's Hospital, and as the Easter Bank holiday weekend draws to a close, I also need to thank all of the NHS staff, all of the other frontline staff who have been working so hard over the long weekend to care for those suffering from coronavirus. We thank you, we pay tribute to you, and we're immensely proud of all you're doing. And can I also take the opportunity to thank everyone who followed the advice to stay at home despite the wonderful weather and despite the challenges and the sacrifices that sticking to the advice presents to many families. I have to say that at the end of last week, we were concerned that people might start ignoring the advice or cutting corners, given the temptation to go out into the sunshine. In fact, the overwhelming majority of people stayed at home and understood the importance of doing so. You stuck to the advice, you denied the coronavirus the social contact it needs to spread, and people should be in absolutely no doubt that by staying home this weekend, you've saved lives, and you've also helped protect our precious NHS at this critical moment in the crisis. So thank you, your efforts are making all the difference, and please keep them up. We've come too far, we've lost too many loved ones, and we've sacrificed too much to ease up now. I can tell you on the latest data that 290,720 people have been tested for coronavirus, 88,621 have now tested positive, and I'm very sorry to say that 11,329 people have now died from coronavirus, every one of them a tragedy, and our hearts go out to all of the loved ones who are grieving their loss at such a difficult time. Amidst this sobering death toll, there are also some positive signs from the data that we are starting to win this struggle. But we've still got a long way to go, and as those grisly figures that I just read out show, we're still not past the peak of this virus. So please, continue to follow the advice, now more than ever, to stay home, save lives, and protect our NHS. This week, SAGE will review the evidence of the effectiveness of the social distancing measures that we've taken, and we will consider their evidence, their assessment, based on the evidence at that point. I should say we don't expect to make any changes to the measures currently in place at that point, and we won't until we're confident as we realistically can be, that any such changes can be safely made. In the meantime, the government will continue to redouble all of our efforts to buy and deliver the ventilators so we can treat the most vulnerable in our hospitals, to deliver the masks, the gowns, the other protective equipment, to protect those on the front line in the NHS but also in care homes, and to ramp up testing so that NHS and other key staff can return to the front line just as soon as possible. The Chancellor and the Business Secretary are working round the clock to mitigate the damage that this crisis has undoubtedly done to our economy, getting support to businesses, to workers, and to the most vulnerable in our society. So please, once again, keep following the guidance to stay home, save lives, and protect the NHS. If we let up now, the virus will only take full advantage. It will spread faster, and it will kill more people. If we refuse to give in to it, if we keep up this incredible team effort, we will beat this virus and we will come through this national test. Our plan is working. Please stick with it and we will get through this crisis together. Now I'll hand over to, I think it's Chris, to Patrick to talk us through the data today.
Thank you.
Thank you, Patrick.
First slide, please. Reminder, as the First Secretary has said, the aim is to keep the numbers below NHS capacity to make sure by doing so we save lives. The mobility change on this slide shows what we've done, what we've all done. We've stayed at home more, we've reduced our activity in terms of retail, recreation, transport, and in the workplace with more home working, and of course even reduced the presence in parks. That is having an effect in terms of reducing the transmission in the community. Next slide, please. This slide shows the number of new cases, but, and this is an important thing to understand, of course it's not all the cases. This is the cases that have been tested. There are many more cases that have not been tested. The blue bars show the number of cases that have been tested for medical need, and you can see that even allowing for some vagaries of the numbers of tests being done, that's at least flattened off, and we would expect that to decrease. The orange bars show the number of people who've tested positive who are in critical care workers, including those in the NHS. And I'm pleased to say there's more testing going on there. That's an important part of what is happening to detect more cases and also to be able to tell people who are negative. Next slide, please. This is, in some ways, harder data. It's data that actually measures things that relate directly to the infection, and that is the number of people in hospital beds with COVID. And here you can see, as I've discussed before, this is beginning to flatten off. You can see it beginning to flatten off in many parts of the country, not absolutely everywhere, but you would expect this to continue to decrease, flatten, and then start to decrease as the effects of that social distancing that we have in place really feed through into the illness that we're seeing in hospital. And then finally, if I can have the last slide, please. This is the slide of deaths, and again, it doesn't carry all deaths in this. It looks at the deaths in hospital. And the reason it looks at deaths in hospital is that's the international standard and which everyone else is doing in terms of reporting deaths. There are, of course, unfortunately, many deaths that also occur outside hospital. We're tracking behind Italy. We're following the same sort of path. What do I expect to see happen? I think this week's difficult. I think this week we're going to see a further increase. Thereafter, we should see a plateau as the effects of the social distancing come through. That plateau may last for some time and then begin to decrease. That's what we'd expect to see in this very unfortunate death curve. Thank you very much.
Thank you, Patrick. David Shupman from the BBC, lead off with the questions.
Thank you very much indeed. Two questions, if I may. One to Sir Patrick Vallance. This morning, David Nabarro, the World Health Organization Special Envoy, described the wearing of masks as becoming a social norm. And in America, the Centers for Disease Control have recommended that the American public wear masks as a measure against people who are infected but don't show symptoms passing on the virus. Is it possible that you would change your advice to the British public about wearing masks when they're out of doors? But first, if I may ask a question to the First Secretary, understanding that it's too early to consider relaxing any of the measures, could you share with us any of the specific ideas you're considering within government for how those measures might be relaxed when that time comes?
Well, I think it's far too early to talk about that. We're still, as Sir Patrick has explained, going through the peak. We are doing all of the work in government to assess the evidence. We'll be guided by the science and the medical advice that we get. And I think until you've got that evidence, we'd be getting ahead of ourselves. The focus right now, particularly after, I think, the relative success of encouraging people to stay home during the long bank holiday weekend is to keep up that national effort, to keep the social distancing measures in place. And there will come a time in the future where we can talk about relaxation or transition, but we're not there now.
In answer to the question about masks, I'm going to answer first the question that you posed as if we saw new evidence, would we change our minds? To which the answer is definitely yes. That's what science does. It looks at new evidence, and we would give new advice if we saw new evidence. As you know, the WHO have stayed with their recommendation around masks. We look at this and update our view from time to time. We're actually looking at it again now. The evidence on masks is much more persuasive for masks stopping you giving it to somebody than it is for you preventing from you catching it. We are continuing to look at new evidence as it emerges, and if there's evidence that looks like we should change our advice, we would do so.
David, would you like to come back with a supplementary?
Yes, if I may, on the question of masks. I mean, clearly, the growing scientific evidence about asymptomatic transmission, people having the virus without realizing it and passing it on, has convinced the Americans of the need to change policy. Might that happen here?
Well, as I said, it might do, because we're looking at evidence all the time. And of course, it's a complicated one because, yes, there do seem to be people who are asymptomatic or pre-symptomatic. By definition, of course, they're not also coughing and doing the things that can spread it. But this is all the data that we're looking at the moment. We have a review ongoing at the moment of the evidence around masks. And if that review concludes that the position should change, we will, of course, make that recommendation. And if it stays the same, we will make that clear as well.
Mark McQuillan from ITV.
Thank you. First Secretary, you've mentioned the lockdown measures are set to be extended. That's what you've indicated there. Why is there no clear plan as yet as to how we get back to normal once the lockdown is over? And also, why is there still no daily death toll for the number of people who are dying outside of hospital?
Well, I'll let Chris talk about how we're measuring the death toll and the different figures. We are working assiduously to make sure that we're ready when the right time comes. But at the moment, the evidence suggests that we're still going through the peak of this crisis, whether that's measured on the death count, the death toll, or some of the other measures that Sir Patrick has talked us through. It's absolutely crucially important that we do not take our eye off the ball or the public's focus on the thing that has been a success so far in relative terms, which is our ability through widespread support for our social distancing measures, to deprive this virus of the means to spread. It is critically important, and I think a lot of people listening to this at home would understand that as we're going through the peak of the crisis with the death toll at the level that it's at and increasing, we're absolutely keen to make sure, absolutely determined to keep our eye on the ball and our focus on what will save lives, which is people staying at home and protecting the NHS in that way. I don't know, Chris, whether you want to say anything further, or Patrick, on the point about social care homes and NHS deaths.
Well, so in terms of death, so the question was, why are we not measuring death toll outside hospitals? And the answer is we are. So there are two separate bits of information that come out, but they come out at different times. The first, which is what we show here and can update on a daily basis, is deaths in hospital. And we're able to get those data relatively fast, and they're proven cases. We know that they actually have COVID-19 from testing. And then the second area of data, which is usually delayed by some days, trying to shorten that period, is the ONS data. And that covers all the people who have COVID as a diagnosis on their death certificate, irrespective of where they have actually sadly died. And those data do include deaths at home, deaths from care homes, deaths in other areas, where the doctor who has seen them thinks that COVID is or is likely to be the cause of death or an important contributor to the cause of death. So those are the two main ways that we're measuring them at the moment.
Mark, would you like to come back on any of that?
Well, I was going to just mention on the deaths outside hospitals, you mentioned the ways that they're being calculated. Will that information be, part of the figures that are released to the public? Is there any plan to release that information?
ONS data is completely open to the public and always will be. And I think that the other thing which it is important that in every situation we look at is not just the COVID direct deaths, but the all-cause mortality. So because some of the way in which COVID is going to be causing death, sadly, is obviously direct from the virus, and some of it potentially is from other causes, which include things like people not being able to get into hospital, which is at the moment, the hospitals are operating very effectively below their ceiling in terms of emergency care, but also things that might be postponed, and also the long-term effects of the economic and other effects on people's long-term health.
Victoria McDonald from Channel 4.
being properly recorded, that we may actually never know the true extent, where you might have people putting pneumonia when it is COVID-19. How can we overcome that? How will we ever see that true figure?
We didn't catch the first bit of it, but I think it was on how can we reliably track the sources of deaths from COVID-19, particularly outside the NHS. Chris, do you want to touch on that, or Patrick?
Well, sorry, more specifically, it was about the true numbers of deaths.
I'm afraid you cut out on us. I think we've got the question. Chris, would you like to?
I think that the most important number, in my view, actually over the epidemic as a whole, is going to be all-cause mortality. So that's deaths from any sort. Obviously, of that, some of them will have been diagnosed by their doctor as having COVID-19. Now, of the ones that are diagnosed as COVID-19, in hospital now, and increasingly it will be true in other settings, that will be based on testing. So over time, the accuracy of that will increase. Our view is at this point in time, most people who have the syndrome that looks like COVID probably do have COVID as a syndrome. Obviously, that wouldn't be so true if we're talking about the period when the flu season happens later in the year. So interpreting these data do become more difficult, but ramping up of testing, which is happening, will allow us to get greater accuracy on this over time.
Victoria, do you want to come back in? I'm not sure we've got a signal with you, but try again.
Yes. Do you, I hope you can hear me. I was very specifically talking about deaths in care homes, because there is some concern that, especially if a doctor can't get into that care home, that they are not being recorded properly.
Patrick, I don't know if you want to.
Well, I think there's one for Chris, actually.
So obviously everybody who sadly dies the doctor will make an assessment based on her or his view about what the cause of death is. That's what the death certificate says in all cases, and doctors take it very seriously and try to make sure that they get as much information to give accurate data. Now, one of the things we want to do is to extend the amount of testing of people in care homes as the ability to test ramps up over the next few weeks. Because clearly, care homes are one of the areas where there are large numbers of vulnerable people, and that is an area of risk, and therefore we would very much would like to have much more extensive testing in that setting, and that will help with this.
Andy Sparrow from The Guardian.
Hello, I've got a question for Sir Patrick and a question for the First Secretary, please. Sir Patrick, you said in your opening statement that when the death toll peaks, there will be a plateau and that will carry on, you said, for some time. Can you explain a bit more what you mean by some time? Are you talking days? Are you talking weeks? Could that plateau last for over a month? And First Secretary, on the issue of PPP, when the Home Secretary was asked about this at the weekend, a lot of people weren't very happy when she was asked to apologise for failings with PPP, and she said she'd apologise if people felt there had been failings. Isn't it clear now that there has been a problem, not just with distribution, but with supply? And why can't ministers just apologise for that?
Look, we understand the importance of getting the PPE to the front line, whether it's in care homes or the NHS. We're trying to give not just the staff on the front line the equipment, but the reassurance they need. I think the strongest reassurance, practical reassurance that they will want and that we can give them is that over the bank holiday weekend, over 16 million PPE items were delivered, and we're straining every sinew to roll them out even further and faster. Patrick, do you want to?
Yes. So if you look at the effect on number of cases in the community, you'd expect the measures that have been put in place to cause quite a sharp decrease. Unfortunately, with the deaths, there's not only a delay, but we would expect there to be a much more gradual decrease from the peak time there, and we'd expect there to be a bit of a plateau. If you look what's happened in other countries, that's what they've seen. That's what we'd expect. You'd expect that to go on for 2 or 3 weeks, but I can't be absolutely sure on the time of that.
Would you like to follow up there, Andy? We're not hearing you. Okay, I'm afraid we'll have to move on to Martin Brown from the Daily Express.
Foreign Secretary, I just want to take you back to your opening remarks where you said our plan is working. But we've seen so far that testing has been slow. The government's frantically trying to get ventilators. Frontline NHS staff are still struggling to get hold of PPE. And some experts are predicting that Britain will have the worst death rate from coronavirus in Europe. So was this all part of the plan? And Sir Patrick and Professor Whitty, what specific evidence are you looking for, scientific evidence are you looking for to reopen schools? And do you think it would be wise that the UK follows the European example and opens schools so soon after their supposed peak?
So, Martin, the two crucial things in terms of, as we've always argued, flattening the peak and making sure the NHS can cope is, on the one hand, getting people to follow the guidelines about social distancing. They've showed the forbearance, the sacrifice, which has allowed us to deliver on that. It's been a national effort. A lot of people have, particularly when you think of the warm weather, people with young families, that's been a success. In terms of delivering on that side of things, and that has helped limit the spread. I know it's difficult when you look at the death toll and those figures, but we are seeing signs of tentative signs of a flattening out, and that was the original plan. The second thing is making sure that the NHS has got the capacity, indeed some headroom, whether it's critical care beds or the ventilators that can support those who need it. And on those two key aspects, and I'm not saying there haven't been challenges right across the range of different things that we've got to achieve, but on those two critical aspects, actually we've got ourselves into a good place, and so the key thing is to keep delivering on that plan.
In terms of timing of changes, I think it's really important that we're now at a stage when you can begin to see the flattening. We'll look and see where the peak is and when we are firmly the other side of it in terms of numbers coming down. Only at that stage do you start looking at what measures might be released and how they might be released. It would be a complete waste of everything that everyone's had to do till now, and I absolutely understand the difficulties that some of the decisions make, but it would be a waste if we were to rapidly reverse that and lead to a re-emergence of this. The key is to keep that R value below 1 and to see this on the way down. Once it gets above 1, you start to get this exponential growth again, which we cannot afford to have, nobody can, and therefore the timing of these decisions, including things around schools, will have to be taken in the light of evidence and data as it emerges.
And of course, if we took our foot off the pedal too early, if we eased up too early, we'd risk a second wave, and that would be particularly damaging and would, I think, even for businesses, some of whom are particularly concerned, have been asking for more clarity, I think would be particularly damaging for them. So we want to take the right decisions, as we've always said, at the right time. Would you like to come back on any of that?
If I may, just on the R value, actually, Sir Patrick, how close are we to getting towards that? Are we nearer the 1 than 2, for example?
Well, I think, as I've said recently, I think in the community, you'd expect the R now to be below 1 in general. And we're going to review that again this week, but that's what you'd expect in the community. It doesn't mean overall it's below 1, because we know that there are cases in care homes and in hospitals where there's still infection being picked up. But in the community, with the distancing in place, the R is expected to be below 1.
Can I turn to Patrick Maguire from the New Statesman?
Good evening. Professor Whitty, you said that 1 in 10 care homes were infected last week. Have you any advance on that figure? Is it going up or is it going down? And how can you accurately model the spread given that testing is so haphazard? And First Secretary, what sort of economic modelling have you done on the various lockdown exit scenarios?
Patrick, do you want to...
Shall I do the care homes?
Chris, go ahead.
On care homes, so at the moment, the total number cumulatively across the whole country is around 13.5% overall. And in the last 24 hours, there have been 92 care homes where an outbreak has been detected. So that's a direct answer to your question. In terms of testing, of course, if an outbreak is suspected, then the public health authorities will go in and do testing to assess whether an outbreak has occurred. And that is going on all the time and has gone on through this. And that allows the care home staff, who are absolutely fantastic and are doing a very difficult job, for the benefit of the people who live with them. They can then isolate people who are symptomatic and try and make sure that this does not spread within the care home.
And Patrick, on your other question, we're looking at all the data, whether it's economic, health, social outcomes in relation to all of the measures that we've got in place. And indeed, when the time is right, we will look at them in terms of any changes we've made. But we're not there yet. And as I said, we want to keep the focus on maintaining the social distancing measures for all the reasons that I think have been backed up by Sir Patrick and Chris today. Would you like to come back on any of that?
Yes, just on the question of PPE in care homes, there have been complaints about cost from care homes. How are you ensuring that cost is no barrier for care homes in terms of them getting adequate PPE, and especially with the demands on hospitals, sort of how are you prioritising what goes where and at what cost?
Well, cost hasn't been the major challenge for us. It is supply, because it's a very competitive market out there, because there's so much demand for it. And also, I think particularly with care homes, some of the local distribution. So we've had last week one drop of bulk PPE to local resilience forums, and we've got another one this week. Just to be clear about what that means, it's a bulk drop to a group, a body, that can then make sure that they get to the individual local authorities and local care homes that really need them. We set up a hotline, so when there are distribution challenges, and we recognise that there have been some, that they can be unblocked as quickly as possible. So we're doing everything we can, and I chaired a meeting this morning on it. It's something we're looking at a daily basis. We're doing everything we can to try and get the PPE where it's most needed. And I think we're on to Adam Bienkov from Business Insider, please.
This is a question both to the First Secretary of State and to the scientific and medical advisors. More than 11,000 people have died now in UK hospitals after contracting the coronavirus. And one of the government's own scientific advisors, Jeremy Farrar, said yesterday that the UK is, of course, being one of the worst, if not the worst, affected country in Europe. Does the government now accept that it should have acted soon in locking down the country? And in hindsight, does the scientific and medical advisors believe that they should have pushed harder for the government to make that decision earlier? And if they had have done so, could lives have been lost had now been saved?
Well, I'm going to defer to the scientific and medical experts. I'm not sure, though, that that is comparing like with like, either on the data that we've got or the other underlying data that we've been looking at. Patrick, would you like to address that further?
The aim all along, and clearly Sir Jeremy Farrar has been part of the group, has been to get the numbers down, make sure that we keep the numbers below NHS capacity, and ensure, therefore, that the NHS can function. And that has been an absolute aim in this. And so far, that is exactly where we are in terms of keeping this under control, with heroic efforts from the NHS, including increasing capacity, and the superhuman efforts of the doctors and nurses and all the others who look after the patients. The direct comparison around things, I think we need to wait and see how things evolve. There's a long way to go yet in this disease. It's still a new disease. It still hasn't spread everywhere across the world. It still hasn't actually been allowed to be released from places that have got locked down. So I think we've got a lot yet to see in terms of where this ends up. Clearly, it's going to be very important that we concentrate on things like vaccine and therapeutics to get there. I think the measures that we've got in place are holding it in the right position in terms of keeping numbers down and NHS capacity at the moment.
Adam, did you want to come back on any of that?
Yes, well, I accept that you cannot always make direct comparisons between countries. I think if you look at some of the countries that acted much sooner than the UK, South Korea in particular, only had a fraction of the deaths that we've seen in the UK. Isn't it clear that had we acted sooner, days or even weeks earlier than we did, that it would have made a difference in terms of lives lost?
I don't think it is clear. I don't think those comparisons are like for like because of where we are on the curve, as Sir Patrick has mentioned, but also the individual circumstance in those countries. But we will continue to monitor, and we do monitor what's going on in other countries and make sure we feed that into what we're doing here. Patrick, I don't know if there's anything else you'd add to that.
No, I think it's very difficult to make those comparisons, and as I say, we'll be able to look and see this in due course. I think there's a lot to learn from other countries in terms of what we need to do, and we're definitely looking very closely at other countries in terms of how they think about release of lockdown measures.
Thanks, Adam. Thank you all very much.